Hi everyone and welcome to Med Unplugged.
I'm Ayleen Aamir.
I'm Sara Sharaf
And I'm Azim Ahmad.
and we are your hosts.
This podcast is all about diving into the realities of medicine, the things they don't always teach you in school, the myths people believe, and the surprising truths behind the field we're so passionate about.
Today, we're joined by a special guest, Ayleen Aamir, a fourth-year student at RCSI Bahrain and formerly a St. Christopher student. Ayleen, thank you so much for joining us today.
Very happy to be here.
We've all seen the dramatic hospital scenes, doctors sprinting down hallways, yelling out medical terms that sound impressive but don't always make sense, somehow making life diagnoses in under a minute, and have extremely special cases in every episode. These shows have shaped the way people think about medicine, but the big question is, how much of it is actually real?
We'll be breaking down some of the biggest misconceptions these shows create and comparing them to what actually happens in hospitals and medical schools.
Ayleen, I'm sure you definitely have some funny first-hand experiences from med school and your clinical rounds. Today, we will be sharing stories that might just shift your perspective on medicine and give you a fresh take on what it really means to work in healthcare.
So, to start with the very most basic question, which I'm sure you're over by now, why did you choose medicine?
I've answered this question so many times to everyone in my personal statements, people who come to uni, things like that. But it's an important question. Choosing medicine has to be something that you pick on your own, not something you're pressured into, not something, oh, my parents told me to do it, or my friends are doing it, so I'm gonna do it, or it's the only thing that makes sense. You have to really want to do it yourself. Like it has to come from within. I personally chose medicine. I grew up seeing it everywhere in my own household. I gravitated towards it in school with the bio and chem, and it's something that just made a lot of sense to me. And then I kind of looked into it. I asked people who were in med school, people who were doctors, and a lot of things clicked. And I was like, okay, like this is something that I could do. And then just to kind of consolidate everything, I did an observership with a gynecologist. And I think my first day, I was like, yes, this is it. Like, this is exactly what I want to do. Like, this is meant for me. And
Was there a
then,
moment, during your observership where you were like, yeah, I definitely want to do this?
so in gynecology and obstetrics, it's childbirth. So seeing a mother with her baby for the first time and she is
Yeah.
worshiping the ground that this doctor is walking on,
Yeah.
it was just something so insane to see. I was like, yes, this is what I want to do. I want to make people happy. And this is how I want to do it.
Yeah.
So like for me, that was the
That
final
was
straw.
the moment where you're like you got the realization that that's
Exactly.
meant for me.
Exactly.
That's how I feel. Like I feel like there's nothing else made for me but medicine. if that
Exactly.
makes
That's
Like,
exactly
sense.
how you should feel. That's how you
Yeah.
know it's meant for you.
Like if you can't see yourself doing anything else, I feel like medicine is for you then.
Yes, definitely.
Did you have any backup plans, or was it all the way in medicine?
I did not have any backup plans, honestly. Like for me, it was medicine or nothing. You know, like I was like, either way, I'm doing it. Like there's nothing else because I didn't want to do anything else. Engineering didn't want to do it. Law didn't want to do it, and business, I was like, business just didn't make sense to me, like at all. So I was like, it's medicine or nothing.
I completely agree with you. Like I really feel you right now because that's exactly how I feel. So like I'm always like I love medicine. I love medicine, but I feel like I don't know anything about med school in itself. So
Okay.
could you sum up in 3 words how med school is as an experience?
3 words is tough, honestly, but first word would be challenging. Honestly, like med school challenges you a lot. It teaches you a lot about yourself. It teaches you what your limit is and how far you can go. Um, but you enjoy that challenge. Like you really enjoy it. You will love it. Other than challenging, I would say med school is fun. Like a lot of people wouldn't think that, but I think
Really?
med school is really fun. You find your people, you relate to them, you go to rotations with your friends, and
I can imagine.
you know, yeah, and
Yeah.
you get your scrubs and you're sharing that excitement with your friends. You would never find that in school because people have such different interests. At least in med school, like people are on the same wavelength and you have fun in the library even. Like you go and you hang out with your friends in the library. You're studying but you're having fun. So I would definitely say med school is fun. Like it's not all, oh, I'm always like studying, studying, studying. You are, but like you are also having fun,
You
you
make
know?
the most out of the situation.
Exactly.
So, like,
Yes.
before you went to med school, what did you think it would be like? 'Cause obviously, you think it'd be challenging, but what else were your previous like notions to it?
I didn't think it would be as hard as it is. Like I knew it would be difficult, but I didn't think it would be this difficult. It was something like, oh, I can do it. Like piece of cake. I've been able to do everything else so far. A levels were fine, GCSEs were fine. I can do this. No. This is completely different. Like having to balance it all on your own when it's not being spoon fed to you like you are in school, it's a very different experience.
Would you say your relationship with your professors is very different from your relationship with like teachers in school?
For sure. For sure. Like your first 2 years at least, that professor is teaching 200 students every lecture that they give. So you don't have that personal relationship that you do with your teachers. The professor most likely does not know your name and does not know that you exist. Your teacher, at least they know your name, they know your grades, they know what you're up to. It's your own responsibility if you want to have a good rapport or a good relationship with your professor to go and do it on your own. Otherwise, it's not going to happen the way that teachers do it with you in school.
So it's all more based on you and like what you want to do and how you're gonna deal with the workload and meeting your professors and whatnot.
Yes, exactly. It's very independent. Like no nothing is being spoon-fed to you. You are an adult. The second you hit 18 and you are in med school, you are an adult. Like nothing is being given to you.
So Eileen, if you could go back to year 12, what's one thing you do differently to prepare for medicine?
I think one thing that I would do differently is more volunteer work. I feel like it helps a lot. Helping out in your community, doing beach cleanups, volunteering at local special needs schools, working with the BSPCA, local cancer societies, things for kids, teaching kids English. All those things are so, so important because volunteer hours are very important in medicine. You need to learn how to be around people that you don't know, people who need you, um, to really integrate much better into medicine. So that's one thing I would do a lot differently. I think I would also tell myself to take a bit of a chill pill. Like whatever happens will happen. Like take things as they come. And not to be so tense about everything. Like everything will work out. And even anyone in year 12 now, I would give them that same advice.
So, like, a lot of us are conflicted on where we would want to go to university, and I think a majority of our year 12 experience has been deciding what would best suit us. So, the main argument is whether we should stay here or if we should go abroad to, let's say, the UK or America or, let's say, Canada or Australia. So, what would you say made your decision feel right to you?
So for me, I never planned on applying to the US or Canada because to me, I didn't want to do an undergrad and then do grad med school when I had the option of instead of doing it for that 8 years, I could do it in five in the UK or here. The UK, for me, even though I sat the UCAT and I applied, at the end of it, it just didn't make a lot of sense to me because I was like, I'm not a person that does well on their own. And living on my own and doing medicine, I don't know if I'd be able to handle it, honestly. And also, there were things about RCSI here that made me gravitate towards RCSI, such as I don't have to sit a equivalence exam for the UK. I can go directly for residency. They prep you really well for other places that you want to go to. For example, if you want to go to the US, prep you for step 1. You want to go to Australia, they prep you for that board exam. So they keep your options open. But I think mostly the main thing for me for choosing RCSI Bahrain was that I would be at home. Like that was so, so, so important to me.
So, Eileen, you did an exchange year in Ireland. So, how would you compare your experience to living abroad than living in Bahrain?
Okay, so I did an exchange semester, my second year of med school. And I would say that when I first went, I loved it. I really loved it. It was something so different for me. I was on my own, I was independent. I used to go to uni myself, and it was very European, Western lifestyle, taking the bus, walking around the city. and it would rain, which you don't get in Bahrain at all for some reason. Um, and it was very different. And living with other people, people that I've never lived with before, people I'd never seen before, it was very different. And we all became friends, which was so nice. And it's a different experience living with your friends. It's amazing, like so much fun. But at one point, it does become very redundant because it becomes boring. At one point, you miss home. You don't want to keep cooking while you have finals. You have an exam the next day, and you're cramming for your exam, and you're like, "Oh my god, what do I cook? Oh, I need to do my laundry. I don't have clean clothes to wear tomorrow." So it came to a point where I was like, "You know what? No, like this is not meant for me. I can't handle it. I need to go home." And so when I came back, I was so grateful.
So staying home actually helped you do better in your classes, you'd say?
I think so. I think living at home was better for me academically.
Would you still say that you've grown as a person in med school? Because a lot of people say that living on your own adds to your character growth. But would you say that's not really the case for medicine since you're already um, in such tense, stressful situations, which would like help your character grow in itself?
I would say, yeah, like even when I meet people now from school, everyone says to each other, like, oh, you've changed so much. You've grown as a person, you've grown into yourself. I think, regardless of where you go to uni, whether that's you're living at home or you're living abroad, you will mature and you will develop into a person that, like, you feel comfortable as, rather than that person in school you just want to fit in, you want to impress everyone. And I think uni, regardless of whether you're living on your own or you're living with your family, like you are going to mature, you're going to become that person that you're supposed to be.
So you did mention previously that you prepared for the UCAT. Do you have any tips on how we could score really well on that?
Practice, practice, practice. That's the only way to do well in the UCAT, I think. There's no, I personally would say that there's no point in like sitting down and reading books and studying for it. I think the only way to score well in the UCAT is doing practice questions.
What's one thing year 12 students think will be important in med school but like really isn't?
Maybe you might feel like the amount of studying that you do is really important to get good grades. That's not what matters in med school. It's more about sitting down and, like, even if you just sit down for an hour and fully understand what you are studying rather than sitting the whole day and just memorizing on repeat, it works and you will do better than sitting down and memorizing. I think that's one thing. I think people overthink how much they have to study and how much of their social life that they have to give up. You don't. You don't have to give up your social life, and you really don't have to study that much as long as that small amount of studying that you're doing is productive.
So we've talked a lot about, the struggles with the med school, but just to bring on a lighter note, if medical specialties were high school stereotypes, which one would be like the popular kid or the nerd or the class clown?
Okay, this is a good one actually. Um, I think. Oh, I'd have to think about that one actually. Okay, so there neurosurgeons are known to be very like arrogant, and they're known to be very like pompous. We're the best. There's no one better than us. Surgeons, even. I think surgeons would be like the popular kids. Like everyone wants to be them, but not everyone can be. Class clown, it's unfortunate to say, but psychiatry, unfortunately. Like,
Really?
yeah, yeah. People, even though it's such an important specialty in medicine and they're part of every single kind of medical approach to patients, you have to include a psychiatrist. They would be the class clown because they're always the funniest and they have the best stories, and everyone kind of makes fun of them. So I would say they're the class clown. Other than that, everyone's kind of on the same level. Like pediatricians are kind of like the moms of the group. They just care about everyone. Um, Obstetrics and gynecologists, they're very hardcore. Like you do not want to cross them. They might be like the jocks or the bullies, kind of. Um, and internal medicine, sweethearts. You love them. They're so cute. And they're just having a good time. Derma, they're not even there. You're not gonna see them. Like, I think that's how I would classify them.
What are you like set on right now for your residency?
I think right now I'm looking at pediatrics.
Really?
Really?
Yeah, I just did a rotation in pediatrics. I never thought of pediatrics before. Before going into med school, I was like, I'm going to do anesthesia or I'm going to do oncology. I'm going to do something super cool, whatever. But I did this rotation in pediatrics and I loved it. I thought, oh, I don't like kids. Like, I can't deal with kids and their parents. But I think that's something about med school that is so amazing that you go to these rotations and you interact with these doctors and these patients and you completely change your mind.
And you self discover in a way.
Yes, a lot, a lot.
That's so amazing. So we love medical TV shows. Like me personally, like I love watching these shows. What are your personal favorites, guys?
I think Grey's Anatomy.
Of course. But I also love Chicago Med. It always comes on my For You page and I always start binge watching it.
It's such a dramatic show, though.
Eileen, what's your favorite?
My favorite is Dr. House. House MD, the best.
I've never
It's
watched it before.
my favorite. Grey's is okay.
Yeah.
Even The Good Doctor.
I don't like that one.
I don't really like it. Like, it's too dramatic for me. Even Grey's, there's too much drama in it for me. I love House.
So would you say that the reality of these TV shows is not necessarily how it is in med school? And
Oh
like
yeah, for
rotations?
sure. For sure. Like, they make it seem like you are a hero, and when you're an intern, you're being spoon-fed. They do not let you touch the patient. And all the, like, I've seen so many TV shows. Oh, I'm a doctor, like, and the patient can't breathe, and they like stick a pencil or a pen or something into their chest, and it's in the completely wrong position. And half the time, you're not supposed to do that. Like, it's the last thing you're supposed to do if the patient can't breathe. Um, and like in Grays, they have like shootings in the hospital. Like, you have protocols in place for those kind of things. Like, those things would not happen. And even stuff like that happens in the operating theaters. Like, they're breaking sterile field all the time. Like, I cannot tell you the time amount of times I've been watching Grey's. I'm like, this is like they're gonna kill the patient. The most realistic one I would say is House MD. So if you want to know what being a doctor is really like, watch House MD.
So it's safe to assume that most TV shows are like over dramatized. But what's one thing that medical TV shows never talk about that you wish people knew before becoming a doctor?
I think one thing would be the weight it holds over you, like the mental strain that it has on you, that you have someone else's life in your hands. So, doing something as small as giving them the wrong dosage of a medication or writing an extra zero at the end of their dosage could kill them. And it's like attention to those fine details and paying attention to those small things. Like, you don't have to be this big great hero surgeon or this big great hero doctor that everyone in the country comes to see. Like, you as a small GP even are making the biggest difference, you know. And I think that's something that medical shows should show, that there's a lot of mental strain that comes with being a doctor. They make it seem like all sunflowers and rainbows, and it's not like that. Like, there is a balance to both things.
So, as you said, like these TV shows are really dramatized, but is there like a specialty that you think is actually just as interesting as it looks on TV?
I would say surgery for sure. It depends on the type of person you are. Like, some people love surgery and they're really into it and they find it so interesting and they enjoy standing in the OT for 3 hours. Personally, I hate it. It's not for me. I much prefer internal medicine, sitting in a clinic. So obviously, TV shows dramatize it a lot and they make it seem super interesting. Like Grey's, I thought there was nothing better than surgery. And then I went and did it in real life and I was like, no, this is not for me. Like, I don't
Yeah.
like it at all. Um so I would say it really just depends on the type of person that you are and what you gravitate towards. Because if you do like surgery, you might think that Grey's is a very accurate description of how exciting surgery really is.
So on TV, CPR works like 99% of the time. What would you say the reality of that is?
It differs from patient to patient and how severe they are coming in. Um CPR, also the way they show it on TV, is very like, I don't know how to say it other than like low key. Like, when you are doing CPR on a real patient, most of the time you will crush their ribs and you will hear yourself crushing those ribs, but you will
Wow.
still do it because it is life saving for them. Those ribs can be fixed, but like if their heart stops beating, that's it. CPR is very effective, but mostly for outfield. CPR is not regularly done in the hospitals. They will choose to use the defibrillators most of the time, but CPR is a very important skill to know. If you are out on the field, like if you are out in public and you see a patient, like CPR will save their life. I wouldn't say it works 99% of the time, but it works a lot of the time.
And when you do CPR, obviously the heart isn't beating. Do you feel the pressure of that? Like, if you don't do it right, or if you don't get the heart to start working again,
Oh
they will
yeah, for
die?
sure. Like you are scared when you are doing CPR because they tell you you have to be 5 centimeters into their chest. Like that's how deep you should be going. And for you as a person, that's scary because you know how painful that is. You know that they have ribs, that they have their lungs underneath there. Am I going too deep into that? Am I going to puncture their lung? Am I causing them too much pain? Like you are too scared to go that deep. But if you've had the right training, like you will do it anyway because you know that the benefits outweigh the risks. But yeah, it's huge pressure doing CPR.
Eileen, could you just explain to our younger listeners what CPR means and when you would do it?
So CPR is it's a life-saving method for whenever you see someone in cardiac arrest. So cardiac arrest basically means that their heart is dying. It's basically to keep the you're mechanically ventilating, sorry, mechanically beating the heart. Yeah, I think that's it for CPR really. You should go get proper training for it.
So in Grey's Anatomy, you see a lot of the time where they just override what the parents saying or what somebody's saying that they don't want a surgery or they don't want this. What's like the biggest like ethical dilemma that you think like medical TV shows they love to dramatize?
I think like especially in Grays as well, I think the relationship between a patient and a doctor, it is a very very professional relationship. Like you are not allowed to know anything personal outside of what is relevant to your patient medically. And you do not go out of your way to do things for them that are not required. If they have signed a DNR, which is a do not resuscitate, you cannot bring them back just because you are in love with them or you love your patient. You know, it's a very and there are so many hospital guidelines against dating your patients or going out with them and things like that.
Now, you said obviously that, there's specific rules to not fall in love with patients, but do you ever have an attachment that grows for the patient? Like you really care for them? Like you said you work in pediatrics. Do you ever have a really like strong attachment for some of the children?
Okay, so having rapport with your patient is very important. So rapport is not a relationship, but it's more that I'm here for you because I care for you. I want you to get better. Not I have a very personal relationship with you. The relationship is only within the hospital. And when you come to the hospital, we have this relationship. I care about you. I want you to come see me in the clinic. That is very important to have with your patient because you want them to want to get better. If you have a bad relationship with your patients, for example, they are not going to be compliant with their medications. They are not going to want to do the surgeries that you might suggest for them. Um, but there's a very fine line between having an appropriate relationship with your patients and having an inappropriate one. And finding that balance is and how to establish that kind of relationship is very, very important.
So you know that like medical dramas, I feel like they have a very big impact on how many people go into medicine. Do you think if they were to just suddenly disappear or they just never came into existence that fewer people would go into medicine?
I don't know if I would say fewer people would go into medicine, but I think people's expectations for medicine would be lower. Like they wouldn't go into it thinking that, oh my God, like my life is going to change and everything's going to be amazing and I'm going to be a surgeon and this and that, whatever. I think people would have lower expectations, but I do still think the same amount of people would apply because anyone that does apply to med school, they're not just doing it because they watched a TV show. Like they have a lot of other factors for applying to med school in the first place. Like they've worked hard and they haven't just worked hard because they watched a TV show. You know what I mean? So I don't think like it would decrease the amount of people applying to med school.
one last final question. If you could go back, would you still choose medicine and
Oh,
why?
100%. Definitely. Like it's so worth it. You work hard, but like it pays off.
Really?
It's so rewarding. It's so rewarding. You go and you learn about these things in the classroom, and then you see them in real life in the hospital, and then eventually those patients like those people become your patients, and you see that on a daily basis. Like it is so rewarding. You feel like all the hard work that you put in does really come back to you. So I would 110% definitely choose medicine again.
So, if you could summarize our episode today for the listeners in just a few short sentences, what would it be?
I would say that if you want to do medicine, don't give up on it. You can 110% do it. Um, I would say that medicine is fun. Med school is fun. It's not all studying. Like you will have fun. There is a lot of studying, but um, you can also have fun. I promise. And don't believe everything you see on the TV shows. Um, yes, they do paint a good picture, but it's not a very accurate one. Go and do an observership if you want to see what
For
being
sure.
medicine is really like.
And that's all for today for our episode of Med Unplugged. Thank you so much, Eileen, for joining us and giving us a peek behind the curtain of med school life.
Whether you're a future med student or just someone curious about the real deal behind those TV scripts, we hope you've enjoyed the conversation. Thank you so much, Eileen, for having us. We really appreciate your time with us today.
Thank you so much for having me. I loved being here with you guys today and chatting with you guys.
Catch us next time for more stories, insights, and maybe a few more myths to bust. Thank you.